Hello, everybody, and welcome to Pull Up with Limbs and Things. Tonight, we are bringing back some of our guests who have been with us before, sharing about their careers. We want to help someone who's interested in the journey, give some hope to somebody who is either dreaming about our fields, pursuing it currently, or you're kind of stuck, and then give you a chance to answer or ask rather any questions that you might have. So tonight we want to start off that each guest introduce themselves. Please tell us what you do, for how long, and who you are. Thank you guys for joining. Anybody can start.
Oh,
Okay.
hi. Thank you. I'm Tyrande Lockhart. I am a nurse. I've been a nurse since 2008. I currently work in a cardiac cath lab. I've been working in different cardiac units for my entire career. Um, and that's pretty much it.
Okay,
Thank y'all for tuning in. And thank you for inviting me, Chanel.
no problem. Who's next?
I'll go next. I'm Marnie Miller. I'm here in Northern Virginia. I graduated in 1999 with my master's in physical therapy, which is now a doctorate. I worked in sports medicine. So I was an athletic trainer and physical therapist for a number of years. And then I stayed home and restarted my career 4 years ago as an Arbonne consultant. One of the things that I love about it, so I've been doing it for 4 years now, is that you can do it alongside all these jobs you're going to hear about tonight. I wish I had known about it back when I was doing physical therapy, because it's just a huge complement to any job that's about helping people. So I love being able to share it with people as a side gig that they can have to go along with what they're already doing.
And I'm Darcy Beasley, living in Atlanta, pharmacist. I've currently been with in the retail community setting for 5 years. I graduated with my Doctor of Pharmacy from FAMU in 2016. So I enjoy what I do and enjoy to share with you.
All right, and my name is Dr. Chanel James. I am a physical therapist, and I graduated from Alabama State University in 2009, and then with my bachelor's in recreational therapy, and then 2012, my doctorate in physical therapy. And I've been practicing since then. So I'm glad to have everyone with us. Let's talk some questions. Anybody who's watching, if you have any questions for any of my guests tonight, please feel free to put them in the chat and we'll ask them. But first question for me is, how has being in your career been affected by COVID? Anybody? Or ask rather any questions that you might have.
I am not operating technology well, but I had it on the Facebook at the same time. Sorry about that. But I can answer that pretty quickly. I've been really lucky. I have an online health and wellness company, and COVID is a fantastic time to have an online company, especially one focused on helping people with wellness. So our business in 2020 grew by 50%. So I've been super fortunate. I strongly miss interacting with real life people the way that I used to. But like everything, we pivot, right? And so I have been able to take advantage of doing things like this and meeting people that I never would have met otherwise. And I have the opportunity that I can work globally. So there's been, I often feel bad, but there's been a lot of benefits to my business with COVID.
That's good. Don't feel bad about that. Who's next?
The business has to go on. But I guess with the pharmaceutical business, it's kind of changed the way we do business. A lot of times it's become a lot more non-contact. I know our company started offering like free deliveries of prescriptions, so it became more of getting those prescriptions filled and delivered out to patients, to kind of mitigate that risk of contact with people. So that's kind of how it changed our business. And then we got into the business of COVID testing. So that's kind of ramped up some of the business as well. That we do the testing actually at the store, at the location. So it's been a little busy, but it's been rewarding at the same time to kind of see those patients that may have been affected that are doing better. And, so we've been affected, but we've been able to work through it.
Okay. Too positive.
So I'm in the hospital. So, we're open 24 hours a day, 7 days, and COVID has not stopped our show.
Mm-hmm.
At first, we've seen an increase of COVID patients being admitted into the hospital, but the numbers have gone down. So that is a positive where we had most of the hospital was filled with COVID patients, and we changed a lot of our units to COVID only units. But now we only have a few units that have COVID patients. So I would say that COVID is getting better on my end, where we haven't seen as many hospitalizations as we normally would. But as far as my specific department, we only do scheduled cases because we're sort of like a wellness type of area unless you're having an active heart attack. So everyone was scared to come to the hospital. So our census went down and we had to go to the COVID units. And I work nights, so I do the emergencies. And we've seen a lot of sicker patients because no one wanted to come, so uh, they would ignore their heart attack symptoms, and they came in, basically almost not making it. But come back to the hospital, so things are looking up.
Okay, that's good. So, from a physical therapist standpoint, globally, PT kind of suffered a bit in the fact that there are a lot of therapists who were working outpatient because that's a big puller for physical therapy. So a lot of outpatient therapy centers had to close. There were some that actually continued to stay open, but their census dropped. For me, I was actually on maternity leave when COVID occurred. And so it affected me actually wanting to go back. It was more of a choice, though. So I had to pivot, and I pivoted to limbs and things. So for me, I actually really liked telehealth before COVID came, and telehealth has been just so widely put in everyone's face that it's made them want to actually try something new. And so for me, it's been really good that telehealth has occurred to this degree because I do see people via telehealth and in person. So the other question I wanted to ask you guys, what did you want? Did you really want to be in your current profession, and then what led you to it?
So I guess I knew that I wanted to help people, but I did not know exactly what I wanted to do. And crazy story, I always say God led me to become a nurse because I was in college orientation and my mom and I both fell asleep because neither one of us can sit still for more than 3 minutes. And when we woke up, we were the only people sitting down in the auditorium. Everyone was standing up, going their own way. And we both said, let's just follow these people. And then, so we followed them and we went into the room and it was the nursing. So I said, okay, well, God wanted me to be a nurse.
Wow.
So it works.
I love that story. That's awesome.
Mm-hmm.
That is hilarious. Well, for me, I knew I always wanted to do something in the medical field. My initial plan was to go to medical school. And I always tell people, and it's okay, the MCAT didn't agree with that. So, pharmacy, I was, introduced to pharmacy after that. And so got into that. And like I said, I really enjoy it, but it actually wasn't my first choice. But like I said, I enjoy it. So it's worked out for me.
Okay. That's great. I actually, when I was 12, I had my first knee surgery. So I was a soccer player growing up. I had my first knee surgery at 12. My therapist was amazing. And I was like, that is what I'm doing. So I knew from the time I was 12 and I followed through and I was able to do it. I was super stubborn in physical therapy school because you're supposed to come out as a generalist. And I was like, I'm doing sports medicine. Thanks, guys. So I checked all the boxes and did what I was supposed to do, but I got my athletic training certification at the same time. I knew I was doing sports medicine and that's all I did. And I just got really lucky when we moved to Chicago that the company I worked for covered US soccer. And so I got to travel with our national teams and it was awesome. So yeah, it was super I'm definitely one of those people who's like, this is it. And I put blinders on, probably to a fault. I miss out on a lot of things. Yeah. I was just determined. However, nobody grows up and says they want to be an Arbonne consultant, because that's just weird. So I definitely did not plan on this part of my life. And it just, out of need, fell into my lap. I was in a position after staying home for 15 years that my daughter transferred to private school and I needed a job. And a couple of jobs were offered to me, and this was one of them. And I said yes to everything. I just did all the jobs. And you say, you know, God puts things in order for you. I agree. Like, this actually wound up being my way of getting back to helping people. And I just didn't realize it at the time. I just thought it was a way to earn a couple $100. So it's been a huge blessing for me, and everything I loved about PE, I've been able to get back from Arbonne, of being able to, you know, provide healthy living for people. So, but definitely had no intentions of doing this growing up.
Well, for me, I always wanted to be a physical therapist as well, like you mentioned. And so kind of a calculated person. So I went into Alabama State knowing I wanted to go into the physical therapy program. That's the only reason why I went there. And so working each of those steps to lead up to that point was kind of my focus. So yeah, I wanted to do this from a long time ago. So I think we have a question over here. It says, professionally, what's the next big thing in your career? Anybody?
So I could say, for me, I'm not leaving Arbonne. I love everything about it. I'm staying, I'm growing my business. I'm sharing it with other people. So I'm excited about that. But I also, I just got trained in the last year to be a group fitness instructor. So I teach fitness classes now. It's super fun. I got myself in a position with Arbonne that it's grown enough that I made a decision to only be around people who want to be better. So I quit all my other jobs, and I'm just in these really positive environments. So I may go ahead with my personal training, but I'm definitely growing my repertoire of classes that I can teach. I really love that environment.
That's nice.
Mm-hmm.
I have no clue. I started school for my master's in nurse leadership. I thought I wanted to be a leader because I like to, I'm looking for the right word. Sorry, I'm saying a lot. So I thought I wanted to be like a leader so that I could help nurses get excited about nursing and fix some of the problems that are in the hospital and things like that. So I'm on a lot of committees that do that. I write different policies and things like that at work. And I kind of already do that. And I don't know if I want to go into leadership because I only work 3 days a week now, and it's beautiful versus working 5 days a week. So I have no clue what I'm going to do. I'm going to let
maybe you're already in it, because that sounds so ideal.
That could be it. I think that'd be right, Chanel, because I love what I do. I've been on my unit for I think about 10 years, and I don't have anything else that I would like to do.
Hey, that's okay.
Yeah.
Well, I just got into pharmacy management last 2 years, so still trying to figure the ins and outs of that, and then determining next steps really. So just still trying to get kind of comfortable in my position now, and kind of see where things go in the next few years.
All right.
And for me, the next big thing, I don't know. I kind of feel like I'm already in the big thing in terms of having your own business. It's a lot to work all the different areas of your business. Maybe for me, I think it would be expanding to having therapists working with you.
Okay, boss lady.
So here's another question. It says, moving forward, once COVID is under control, how will you transform your business or skills to make you better?
Well, I would probably actually like to do to get into like counseling licensure. So consulting. So to do more pharmacy consulting, with different facilities. So that's probably that'll be probably one of my next steps also then. Once we've got it under control a little bit more.
Oh, I want to hear more about that. How would you do that?
So you have to be under a consultant pharmacist, kind of precepting for a while, and then like I said, you can move into like nursing home facilities as a consultant pharmacist for the facility, and do things. There's a lot of different arenas you can kind of go into with that. So that's always not want to put too many eggs in one basket.
Thank you. Anybody else?
COVID hasn't really changed. I mean, for me, it's not COVID dependent. I think there's always ways to get better. Like I'm definitely working. One of the things my company focuses a lot on that I've never experienced in another company is personal development. So just always working on that internal mindset and what's holding you back there. So that's something that I'm always focusing on. And I know there's always more room, right? You can always be better. So, so that's something that I look forward to, is that every day I can be a little bit better. I can share my story a little bit easier. I can attract a different audience in a different way, and as I grow, I by default become a leader because my team grows. And so kind of stepping into that leadership is something I need to learn how to do.
I will say I don't know.
You're so happy where you're at. You're not changing anything.
Other than continuing school, which I'm currently doing because I said I have to finish my degree because I will start something and decide not to do it, which is why I've been a professional student for a few years now, about 8 years. But other than just continuing to finish school, and that's pretty much it. I may join more committees at work because I'm kind of scared to go into small boardrooms now where they host a lot of the committees. So I got off of a few of them. So that's pretty much it all that I have.
That's cool. For me, I think transforming it to the point that it opens up to more of a global platform. So helping people in different areas that are not necessarily in my geographical area, making me better. I think freeing up some of my time so that it's more work-life balance. I think I've got it, but I think I want that 3-day a week that you're doing too.
Right.
So we have another question over here. It says, although you're just beginning, do either of you plan to retire early? The new generation doesn't plan to wait until full retirement age, currently at 67 to retire. What is your retirement age goal?
I'm not retiring. I'll jump in. I love what I do. I am not, it is a side gig. There's no reason to retire. It is, it gives me all the flexibility that I want. I'd be a fool to walk away from this. So I don't have a specific age because I can take this, this is a job I can take with me anywhere. So
that is really great to hear because, everybody is saying, well, I'm retiring here just as soon as I get to this age. So that's really good, Marnie. I'm glad to hear that.
My goal retirement age is like tomorrow. But that's just to not have to get up every day. Like I said, I enjoy my job, but to not have to get up every day and feel like you're going to work, So, it's just, I guess, the matter of time when I can, afford not to work. Hoping that's kind of sooner than 67, so I can kind of, enjoy later years and travel and, be with family. So I'm going to say 50.
Okay.
So, that's a good goal. That's a good goal.
There's a saying, nurses never retire, especially ones that work in procedure areas. So my job affords me the luxury to get up and go when I want to, since I work 3 days a week. I can schedule myself to like work Sunday, Monday, Tuesday of one week, and then like the end of the next week, so I have a whole week off and I'm still getting paid. So, and I don't know what I would do if I retired, because I do what I love to do. So I would be on board and probably FaceTiming you guys and Facebooking. I bet it would work.
Okay. I don't have a retirement age either. I think I would continue to do physical therapy in some capacity, whether I'm consulting or seeing people 3 days a week, or just scaling back from the current schedule to just a reduced schedule. I think it's important to continue to move, and being a therapist helps you to move all the time. And so I think it would just be beneficial probably to go into more of like a consulting aspect of PT, but also being able to continue to help somebody in some way physically. So that is my answer to that. I think all of you guys had really good responses to that one. We obviously love what we do. So let's see. There's another question over here. Describe your worst experience with a patient. Or for Marnie, with anybody you're working with. I know it takes a while. Let's think.
So my job is more sales related now, even though it's still health and wellness. And sales can be rough. It can be ugly. It can be a nasty world. I mean, I will tell you from my perspective, the worst things a client can do is not answer. I will take a no any day versus a no answer. So that's this. I mean, I don't mind being told off. I don't mind, but at least let me know you're alive, and don't tell me to reach out to you and then ghost me, So yeah, I think ghosting is probably the worst for me.
I understand that.
Well, I have a lot of stories about things that happen in the pharmacy. Because I mean, it still is retail, it still is customer service. So, just getting a lot of times, because we're so accessible also, we get a lot of the issues that are meant for the doctor, meant for the physician, but they can't get to them at the moment. So it gets to be a lot. But like I said, it's still rewarding because those patients don't outweigh the patients that, appreciate, everything you try to do for them. So that's why, I can still get up and do it every day because, those good patients are coming.
That was great what you said, that the good experiences and patients outweigh the bad. Because that is so true. The good patients make it all worth your while. I would say maybe like a worse experience or experiences, because I've had a lot of them, because people do become physically violent with us sometimes when they can't get pain medication, or if they may, be frustrated or scared or anything like that. Sometimes people get physically violent with us, or because I am a young Black woman, a lot of people are racist and they don't want Black nurses or Black people caring for them, which is crazy. But, that's actually, it's not their choice. I was going to say that's their choice, but it's not, because they don't have a choice. But like you said, the good outweighs the bad. So you just kind of keep it moving, as long as no one dies, you're not physically harmed, and you take care of the next patient the next day.
True.
That's what I kind of try to impart to like some of our colleagues, that people are sick, and you aren't yourself when you're sick or when you're taking care of a sick family member. So sometimes we may act out of character, like act out of ourselves, in those situations. So you can't take it personal. You still have to do your job to make sure everybody's getting better.
That was such a great professional response. I agree. That's true, though. We do have to think. A lot of us take psychology classes before you actually go finish school, and that's kind of part of it, in knowing how to deal with all personality types, right?
Mm-hmm.
So your best experience with the patient or anybody that's in sales?
I think maybe my best experience was I had this it was funny because I'm a goofy girl. So I had this one patient. She was older, about 91 years old, and she was trying to tell me that her doctor was Dr. Fauci. and and she wouldn't let anyone talk to her until they got him like there to talk to her. So I'm sorry, it was so funny. And another one was another older person. Somebody asked him, "Do you need anything else?" And it was like, "Yeah, let me get one of those Tyrandes," because I don't know why they called me like they thought I was a thing or something. I don't know.
Right.
So they came and got me. Stuff like that makes you that tickles you and just brightens. Yeah, I like stuff like that.
Yes, and you need a little laughter in your life.
Mm-hmm.
Mm-hmm. Anybody else?
And one of my favorite patients when I was treating patients, and it kind of fell under the best and worst because you guys didn't bring this up, so I don't want to put it downer, but insurance causes a lot of difficulties. So we don't need to spend a lot of time on that, but I'm sure the pharmacist could speak strongly to that as well in terms of people being angry. But I had a patient who was my just favorite, and he was an older gentleman as well, but he was in the Olympics for speed walking. So and I guess there's a master's level. I don't know a lot about it, but he came to me because he kept being disqualified because as you get older, your muscles get tighter. And if you don't properly heel strike in speed walking in the Olympics, you're disqualified. And his hamstrings were tight, so he wasn't getting a full heel strike.
Yeah.
And I got to work with him. I mean, he was a great athlete. He was well into his 80s, but he just had tight hamstrings. But it was truly, it was life altering for him because when you're an Olympic athlete and you can't compete, that's a big deal. So Medicare maybe didn't view it the same way, but we had to work through that. But I loved watching him progress and being able to compete and do it. That was definitely a fun moment. So I've had some great Arbonne moments with clients being able to get off of medication and losing lots of weight, and that's super amazing. I have a teammate who was able to buy their dream home, like super cool stuff like that. But that older gentleman from the Olympics was just such a special patient and working so hard, and he just was so frustrated that he kept DQing. So.
Oh, I forgot I didn't share about my worst experience with the patient. So I had a lady actually recently who she just stopped wanting to do therapy. And I think that it felt worse for me because I knew the potential she could have, and she just stopped on her own. So we're getting back together. But for me, that was a bad experience just because I knew we could get further sooner. And of course, just like you were saying, insurance has a specific deadline. They want to see progress. If we're not making it, then they're ready to cut you off. So there are ways to circumvent that with cash-based businesses. But a lot of people aren't really understanding those things enough, or just think that insurance is the way, right? We've kind of, in the whole, I guess our mindset is set from when you're working, having insurance to cover you, and you're paying for it, so you want to use it, right? So I get that. My best experience with a patient, I used to work in a psych unit, and I had a gentleman who, it was Easter time, and I don't really remember what his medical diagnosis was, but he thought he was Jesus. And so he, yes, Tyrande, he was saying that he was going to die and that he was going to rise on Sunday and he was going to be crucified, the whole story. everybody, all the nurses, nobody could like talk him and calm him down. And he just kept hollering my name in the hallway. And he's in a lock unit, confined, the if you've seen something on TV that looks like people in a straitjacket, the lock unit. So I was working on one of those units. And he was behind the lock unit, but he was declaring he was Jesus. And so it was nothing that anybody could do. I just sat there and listened. And sometimes you have to play along with people in order for them to calm down. And so I just asked a series of questions. So when are you going to rise? And how is it going to happen? And all of these different things. And it actually was beneficial to him. They did not have to use any form of calming him down with medication or anything like that. So that was a good experience, even though it was a weird one.
Oh, that was good.
So let's see, there's another question here. What inspires your career choices?
So I kind of talked about, I knew when I was 12 that I was going to do it. In terms of Arbonne, though, it was a need. It was my kid went to private school and I had to pay for it. And I had a realtor and an Arbonne consultant both say, do you want a job? And I said yes to everything. And just, it was a short-term need that turned into learning a lot more about it. So, and now I would say inspired is the perfect word. Like I am just so inspired because I know I can help people. And so that's where my inspiration comes from, is that I have a tool that can help people. And so being able to share that is pretty awesome.
And I would say, and our professors used to say it all the time, that everybody wrote on their essays, everybody wrote on their applications that they want to help people. Yes. So, and I can see that's probably all of our reasons for being here, but it's just, it's rewarding to be able to, help people, when they're needy or when they're vulnerable, So it's just very rewarding profession.
So for me, I told y'all nursing chose me, or God chose it for me, a combination of the two. But as far as cardiac nursing, cardiac was the thing I found the most interesting in nursing school. Although I would kind of sleep through most of my classes, it was the only thing I stayed awake for. So I said, this must be something I should investigate further. Because with nursing, you can graduate from nursing school and literally do any kind of nursing. You can, whatever you want to do. Nursing goes into so many different things. You can even venture into law. You can do just anything. So I said, okay, I like the heart. I didn't fall asleep during the lecture about the heart. So I picked it and I enjoy it. And it's something new I learn at work every single day, which is still amazing to me, still inspires me. And so I get instant gratification. So I like emergencies. That's why I work the night shift, so I can do the emergencies. But literally you see the people dying, like their heart muscle is dying, and within a few minutes of me doing my job along with the rest of my team, they're up talking, asking questions. They usually ask for something to eat because they've been vomiting and they're hungry. They're completely different people, and it's very rewarding. I enjoy it.
I see the theme is what we all have said, that we want to help somebody. The same is true for me. I enjoy seeing people go from I can't to I can. It's kind of why I wanted to do more like subacute PT as opposed to working with more well people and like outpatient or people that are really sick in hospitals. Though the window between the two is where people kind of get lost in maintaining their function. And so that's why I wanted to go there. But physical therapy is so vast. There's so many different ways to work or settings to work in. I've been in quite a few, but and every time I've gone to a different one, it's like a new learning experience. So it's like you're getting a new career going to another setting. So with all of the ones that we've mentioned, we've talked about how you can go to this point and still be a pharmacist. You can go to this point and still be an Arbonne consultant. You can go over here and still be a nurse. So there are different ways that you can continue to be in that profession, but do it a different way that makes it more interesting as you go along. So we have another question here. It says, who is your mentor and what's the best advice he or she has given you for your professional career?
So I have, like I said, I'm in school for nurse leadership. My nurse leader, the director of my department, is actually my mentor. Her name is Dion Ross. And her best advice she gave to me was do it for the right reason and make sure you're always doing the right thing. Because sometimes you can get frustrated in nursing or, things don't go your way. But as long as you know that you're doing the right thing and for the right reason, you're always rewarded. You can't be in the wrong, because sometimes things can get a little hazy when it comes to like politics in nursing and developing new rules or following new rules or doing things that's supposed to be like the best practice. So things get a little foggy sometimes, or but as long as you're doing the right thing and for the right reason, you're covered. And your heart is filled and also pure if you're doing it for the right reason.
Yeah, I can piggyback on that. I have a couple of amazing mentors that I work with, and one of the things that always sticks with me is just like you were saying, do the right thing, but don't become emotionally attached to the outcome. Mm. You do you. You're doing the right thing. The outcome is out of your control.
Yep.
So, and that's something that stuck with me that I constantly remind myself and my team about.
It's hard, Marnie.
It is hard. Yeah, it's really hard.
I'd say one of my mentors was one of my professors in pharmacy school, Dr. Michael Scott. His thing was always pharmacy is small, and you have to always remember that. And so the things that you do, the decisions you make, can affect everything that you will do in the future. So you have to treat people right. That goes for colleagues and patients. So that was always the thing, like treat people right. Remember, this is a small world, very small world.
My mentor was Dr. Linda Woodruff, and she is now deceased. I really haven't found like a new mentor since her passing. However, I think the best thing she did was show me as opposed to tell me. And that was more so of how to get with a good support group. And so that you can continue to grow in your profession, but also never to stop, to keep pursuing what it is that you're working toward and be zealous in doing so, and do it with a passion that you really want to have an outcome that'll be beneficial, not only for you, but for those that you're working with. So I have a final question. It's kind of not, I guess, typical, but if you weren't doing what you're doing now, what would you be doing?
Is this pre-COVID or?
I think you should answer it as now.
Okay. If I was not doing what I do now, I would want to be like one of those travel bloggers that travels and does it for free and lays on the beach and then like eats all the food. And that's the only thing I could think of to do, and then write about it so that they can have me back and I can do it again for somewhere else.
Okay.
Harrison, you got something? I'm not sure.
I would. It probably would have been education. That was probably the next step if pharmacy school hadn't worked out. To go on education, just because I love science. And I don't. A lot of times, especially in inner city schools, you don't see enough young black science teachers. So a lot of times it isn't, cool to be smart. So just to show, other, young kids that you can be smart, and it's okay to to want to be smart. It's okay to be a nerd, you know. So that was going to be, I think, my next step. If pharmacy hadn't worked out, that education was going to be probably the next step.
So I shouldn't have let you go because now it sounds like I'm cheating. Because so that was what was in my head was teaching. So I don't want to steal your answer, but yeah, I mean, one of the things I always go back to is research, right? So like when I was in physical therapy, so I went to a science and tech high school. I picked a master's program that was very research heavy. I do all the research on the nutrition side. I've delved into that. Like I'm super research heavy. So I definitely appreciate that. But if I'm going to modify it just a little bit to be unique, I think it would maybe be coaching would be the other aspect is I did coach soccer for a number of years and loved every minute of it. And any chance you can get to get that spark in a kid's eyes, to get them to see that they're so capable, and when they're so questioning everything that they're going through at that time is so rewarding. So in order not to copy, I'll go with coaching. Yeah.
Can I change my answer?
Sure. While I keep thinking of my answer, sure.
I'll read your blog. You're good. I want you to go. I want to read all about it.
Me too. I want to go somewhere. No, that's still my answer.
I think teaching is great, and I probably would do college level teaching. I think there are some things kind of in the PT profession that you learn after you get out that somebody still should have taught you when you were in school. That's one thing, but completely different would probably be being, I guess, like a newspaper editor or writer. I like reading things, but editing it. The red pen you used to see all the time in your notes. I like that kind of stuff. So that would probably be what I would do. Okay, so last question. For the person who's considering going into your field, what are 1 to 2 things that they need to do to be successful?
Mine would be, I'll give 2 things. The first thing is to always be optimistic and positive. With nursing, that's like the basis of it. You have to be a positive person because what you have inside has to shine outside so that you can care for people. And nursing takes so much compassion. You have to have it. So you have to be positive and have compassion. The other one is the nursing school is hard. So you just have to study. Like just study. You have to study. And then once you graduate, you can party. Like don't worry about the partying in college. Go straight for the books. Even, I know it sounds cliche, but I'm really serious. Studying for nursing school is pretty tough. It kind of takes away your college experience if you want to be really successful. Even if you know how to have work-life balance, because your nursing school is the foundation of you taking your NCLEX, which is the test that you have to take to become a nurse, and also you caring for people. So you don't want to cheat or like skip something because you can harm someone because you gave them the wrong medication or you performed the wrong procedure or anything like that. It's a person's life. So taking it very seriously and being compassionate, those are really important.
So I'll jump in because I have a freshman in nursing school. So I'm going to make sure that she's tagged on this post. I'm sure she's taking everything really seriously, but just in case, we're going to make sure that she heard what you said, Tyrande, because I think that was great advice. But I mean, for me, it's pretty simple. Be coachable. Listen, don't think you know everything. Just come in with an open mind, and you'll be really successful.
Mm-hmm.
For me, I would say persevere. Like you said, pharmacy school is definitely hard. So you have to know yourself and be able to persevere through those hard times. Because there are going to be times that you won't sleep. because you got this big test coming up. There's times where you have to cut everybody off to get done what you need to get done. So perseverance is absolutely key. And another thing to those that are interested, if you know you want to go into pharmacy, even out of high school, pharmacy can be a 6-year degree. Straight out of high school, 2 years of prerequisites, 4 years of pharmacy schooling, you're done right out of high school. So if that's something that you know you want to do, instead of doing, I guess the route that I took, 4-year degree, and then went and got did the 4 years of pharmacy school. If you know that's something that you're interested in, know that's something that you want to do to help people, go ahead and look into it early. And if you know students that are interested, let them know that you can have a doctorate degree in 6 years. At 25. So it's definitely rewarding. And so I'd say those probably my 2 points.
Yes. And so PT school is hard too. You can get your degree undergrad in anything. I did it in recreational therapy. What did you do, Marnie?
I was a psychology major.
See, look at that. Mm-hmm. And then you can go into PT school. It's another 3 years to get your doctorate degree in physical therapy now. Some programs actually are doing an accelerated 2-year program. For me, Rhonda and I went to high school together, and Banneker was already accelerated. And so I didn't want to go to a graduate program that was also an acceleration. So for me, that's what helped me to be successful, not just having everything being accelerated. However, when you are in any profession, whether it's PT, nursing, pharmacy, or being a consultant, I think it's important that you check your reason about why you're going into it. If it's just for the money, you might want to reconsider, because you definitely have to have a love for people, especially in these professions, because we are so people oriented, and you have to be able to, I think, adjust, because like we've all said, there's so many different ways that you can be a pharmacist, a consultant, or a nurse. That's the same way in physical therapy. Being able to be flexible is helpful in any job, right? Especially right now, we're all having to pivot because of COVID, whether it's staying in your career or actually changing fields or doing something completely different. Being able to be flexible is important, but also checking your reason about why you want to do it. So let's see.
So Marnie, your daughter, she can go to parties on the weekend, on Saturday. No Friday night. That way Saturday morning you can still study, and then Sunday you're prepping for Monday's class.
Okay, I'll let her know.
Okay.
It looks like you have a question. Harrison, Dr. Beasley, I'm sorry. Can you go back over what you said you need for a pharmacy degree?
So, Mr. James, what I was saying was you absolutely have to have a degree to be a pharmacist. But you don't have to get necessarily a bachelor's degree before you can go to pharmacy school. A lot of my classmates had associates or had even just done the prerequisites, because there's a pre-pharmacy track where you, like I said, start out your freshman and sophomore year, taking your prerequisite classes, and then apply to pharmacy school. So that's, like I said, if you know that's something that you want to do, that's to me the smartest route to take, the lower debt route to take, if that's something that you know you want to do.
Right, and that's important to mention too. You definitely want to know what you're going to do, if it's definitely going to cost you. For me, I worked hard to get scholarships for school. That is a possibility. Just so you know that there's not always the student loan route. You can work hard to get the scholarships and funding that you need to go to school as well.
And also, a lot of jobs pay for you to go to school. Like, I'm just going to say MedStar Washington Hospital Center. They'll pay for you to get a degree if it's in the field that would benefit the hospital, for anyone that is looking for a job. And
that's good information. Yeah.
Education. A lot of like schools that are teaching schools, hospitals that are teaching hospitals will pay for you to go to school.
Another thing my daughter is looking at, I know it's not about me, but she's looking at joining the military possibly after graduating and letting them pay for her nurse practitioner degree.
Yeah.
So that's another option as well. That is a great use of not my money. And thank you, Brandon. I appreciate the comment about my age. We'll let my age be quiet, but when you use good skincare and take good care of your nutrition, it's amazing how young you look. So I'll just use that as an advertisement.
All right. So I want to thank you all. Well, go ahead, Dr. Beasley.
I will plug though. Like if anybody is here, maybe interested, or any kids that are interested in pharmacy, I am hiring. So that is.
Tell us where you are.
If you're in the Atlanta area, the Cobb County area, the South Cobb County area, I am hiring. If you are interested in being a pharmacy technician to kind of see the ins and outs of the retail setting, if that's something that you want to do. So
start earning some funds, right?
Yeah, exactly.
Go ahead now. I like that.
Yeah, Dr. Beasley, I went to Emory University, so I was in Atlanta for 8 years. That's where I got my degree from, so I know the area well. So, yeah, I've got some people watching from that area.
Yeah, and then for me with LIMS and things, I'm always interested in having students to join my telehealth sessions, even though COVID has limited how many students you can have or how many students can actually go into a mobile setting. Just to limit exposure to patients, I do allow people to sit in on telehealth sessions, and not just students, but those who are actually practicing who haven't done telehealth before.
Awesome. And anyone ages 18 and above can become an Arbonne consultant. That's the only restriction we have. You don't need a degree. It's alongside. It's a great thing to do for college kids to earn some extra money while you're in school. So anyone 18 and above, happy to talk to them about what that would look like.
All right.
All right. Thank you guys so much. I've enjoyed talking to each of you and learning from you. And I appreciate your sharing your information with our audience tonight. If you have social media handles or anything you want to share and how we can contact you, if you'll put it in the chat, you can also say it right now if you like.
I'll add to the chat that way they can click and go. Yeah.
Okay.
Yeah. Thank you.
I don't know how to answer the chat, but is it this chat button?
No, it's when I close it out and then you can put it in the comment.
Okay. I don't have my real name on Facebook because of patient privacy stuff. So if anyone wants to ask me any questions, feel free. I think it's Sunny Dushini. I think Dushini is a kind of smile. It's when you use all the muscles in your face. So I like that.
Yes.
So SUNNI space Dushini DUCHENNEY. I think. Yeah. So feel free to hit me up. I'm very friendly.
Thank you guys so much. I hope this has helped somebody. Dr. Beasley, go ahead.
I was going to say, you can find me on Facebook, Dr. Harrison Beasley. For any questions, you can message me. Email address, hbeasley, BEASLEY1906 @gmail.com. So if you have any questions, or anybody that's interested in working, just let me know.
All right.
Yep, and I'll put my
email. This was great.
Thank you guys so much. I appreciate you.
Thank you.
Nice meeting you guys. Thank you for everything. Thank you, Chanel.
No problem. Take care, you guys. Have a good evening.
You too.
Bye.